Abortion. Abortion is divided into two, that is, spontaneous abortion and induced abortion. Spontaneous abortion, it comes spontaneously. Induced abortion means we are inducing abortion due to some reasons. It may be legal or illegal. Illegal, it's a criminal offense, and that may lead to septic. Okay, then spontaneous abortion, it is divided into two, that is sporadic or isolated. Then recurrent abortion is otherwise known as habitual abortion. So it is divided in different form again. Okay, so that is threatened abortion, inevitable abortion, complete abortion, incomplete abortion, missed abortion, septic abortion. So this is the classification. So abortion is mainly divided into two, that is spontaneous and induced. So in induced there will be legal and illegal. In spontaneous there will be isolated or sporadic and also the recurrent or the habitual abortions. And again it is divided in different form, that is threatened, inevitable, complete, incomplete, missed and septic. So these are the types of the abortion. Now we can see which all are the characteristics or signs and symptoms of miscarriage. So in threatened miscarriage or threatened abortion, the pain will be variable, bleeding will be scanty, and usually the cervical os will be closed, and uterus will be soft and no tenderness. So mostly the threatened abortion, here there will be pregnancy is possible in case of threatened abortion. Okay, next one, inevitable miscarriage or abortion. Here the pain will be severe and rhythmical. So the rhythm, due to the rhythmic contraction, the patient will have the pain, and blood clots will be heavy clots. The patient will have the heavy clots, and cervical os open, and uterus will be tender, maybe a smaller pain expected. So usually in inevitable miscarriage, usually the aborted material, it will be go. Okay, so the person will lose that child or lose the pregnancy. Then incomplete miscarriage. In incomplete miscarriage, pain will be very severe and bleeding will be heavy and profuse. Then cervical os also open. The uterus will be tender and painful. Then abdominal signs and additional signs and symptoms are tissue present in cervix, and there may be chance for the shock. So here it is incomplete abortion. So the expelled material may be lodged in the cervix also, and there may be, due to the excessive bleed, there may be chance for the shock. Next one, complete miscarriage. In complete miscarriage, the pain will be diminishing, and the bleeding will be in minimal, and the cervical os will be closed, and uterus will be firm and contracted. So in complete miscarriage means everything will be loosed, and everything will be in the normal position. That means the os is closed after the expulsion. Then delayed miscarriage. Delayed miscarriage, there will not be any pain and bleeding. Some spotting will be present for this patient, and it may be brown in color. Then cervical os will be closed, and uterus will be smaller than expected. That is the delayed miscarriage. Then in septic miscarriage, there will be severe pain will be present and bleeding that may be smelly and offensive, and the cervical os will be open, and the uterus will be bulky in nature, and the additional symptom is maternal pyrexia. So these all are the symptoms of miscarriage or the abortion. So here threatened abortion can be served securely. In missed abortion, there will be no vaginal bleeding, os will be closed, and the fetal cardiac activity will not be there, and the sac will be empty. So in the missed abortion, the pregnancy will be lost. But in case of threatened abortion, there will be vaginal bleeding and cramping. Cervix will be closed and soft, but fetal cardiac activity will be present. So the pregnancy can be maintained. Next one, incomplete abortion. Vaginal bleeding and cramping will be there. Dilated cervical os will be present. Some products of conception is expelled. So in incomplete abortion, there is some products will be retained there, and some products will be emptied. So DNC may be needed for the complete evacuation. Next one, inevitable abortion. Here vaginal bleeding and cramping will be present. Rupture of membranes also present. Dilated cervical os. Products of conception may be seen or left at or above cervical os. So in inevitable abortion, the pregnancy will be lost, and here the os is dilated. That's why the products may be present in the cervix also. Then in complete abortion, vaginal bleeding will be present, os will be closed, products of conception completely expelled. So here there is less pain. So this is regarding the abortion. Thank you.